All right. So Dr. Maryellen here. Welcome everybody. I have my phone set up here in case questions come up through the live over the next half hour or so too. If you don't know me, I am a naturopathic doctor who is passionate about providing you with the information you need to make empowered decisions and empowered choices about your health so that you can be your health advocate. To tie in this lovely month of May being Women's Health Month, I have created a 4-week series all about women's health and touching topics that are near and dear to my heart. So tonight we are starting off with owning your cycle. So without further ado, let's dive right in. So on the agenda this evening, we're going to be looking at getting a better understanding of your hormones. What are your symptoms telling you? A comprehensive hormonal assessment from a naturopathic doctor, what that looks like, as well as a naturopathic approach to balanced hormones. So I'll talk about diet, lifestyle, supplementation. And stay tuned till the end because there will be information on a free download for you guys as a thank you for joining in and to keep the conversation going, as well as a giveaway that I'll be conducting at the end of this 4 weeks to celebrate you in taking that leap to better health. So understanding your hormones. So particular hormones that I'm going to be talking about this evening are your reproductive hormones. So we'll start off with LH and FSH. Those are released from your brain and they signal your ovaries to create your other reproductive hormones, estrogen and progesterone. So LH in particular, it stimulates estrogen and progesterone production from the ovaries. It surges mid-cycle to stimulate ovulation. So LH is something that we can actually track to see if you've ovulated. There are ovulation predictor kits and ovulation test strips that you can use that actually track that surge in LH that can tell you if and when you're ovulating. So that's something that we can look at to if fertility is a goal of yours, or if we're looking to optimize or regulate your cycles, we would look at that LH through test strips. And FSH, or follicle stimulating hormone, this one actually stimulates the maturation of your ovarian follicles. So in your follicles, that is where your eggs are produced and mature. So FSH is important for that. Then we look at our estrogen and progesterone. So the key players that we look at when we're dealing with reproduction, period health, and all the joys of our monthly cycles. So estrogen, oops, I think this is wrong. Estrogen stimulates it's produced by the ovaries, and it surges mid-cycle to stimulate ovulation. Then it also promotes muscle gain, insulin sensitivity, and long-term, we can help the health of our bones, our brain, our cardiovascular system. So estrogen, it has so many functions, over 400 in the body, that are really important for not only reproductive health, but overall health too. And it's a predictor of your overall health when we have optimal estrogen levels. Your progesterone, it stimulates the maturation of your ovarian follicles, regulates the lining of your uterus or endometrium, reduces inflammation, regulates immune function, supports your thyroid, bones, and breast tissue. Now, this is a very popular graph. So this is something that you might have taken a look at in high school science, but I like to use this as really an educational tool to let you know what your cycle is all about. So often women don't know, what is day one of my cycle? Is day one the day after I stop bleeding? Is day one the first day that I'm bleeding? And the answer is day one is first day of your period, so first day of bleed. And that brings us up until day 14 around, if we're having a 28-day cycle. Day 14 is ovulation. So those days from 1 to 14 are your follicular phase, which I'm going to get into more detail next. And then after ovulation to the next first day of your next period is your luteal phase. So we can see some different changes that are happening in the body at these cycles. And during these phases. So we have our basal body temperature, here it raises in our luteal phase. So that's another way of tracking if we've ovulated, because your temperature is going to go up. And it's that temperature that you test first thing in the morning before you do anything. And then our hormonal levels, of course. So this is the general pattern, the rise and fall that happens with our hormones every month. So you'll see this pink and light blue, that's our FSH and LH that come from the brain to stimulate that ovulation. We have our estrogen here in gray, which is higher in our follicular phase, and progesterone, which goes nice and high in the luteal phase. Then in the ovary itself, this is how our follicles mature, release the egg. And then once the egg is released after ovulation, the follicle turns into something called the corpus luteum. And in the actual uterus itself, we can see menses, that shedding of that uterine lining. Our proliferative phase is when we start to grow a healthy uterine lining. And then the secretory phase is when we ensure the health of that lining, but we're preparing either for implantation or for it to shed if we do not fertilize an egg. So our follicular phase, it's broken down into 2 steps. So it starts with your menses, your period, and that's when your uterine lining is shedding. And estrogen and progesterone are their lowest at this point during your period. Then we have that proliferative phase. So this is when rising levels of estrogen, that makes you feel really, really great at this point in your cycle. So if you haven't ever thought to check in and actually take a moment to scan and see how you're feeling at certain phases of your cycle, it's pretty interesting to see the patterns that exist. So we really see an increase in your confidence, your energy at this point in your cycle. Your ovaries are producing and maturing follicles to get ready for ovulation, and your endometrial lining is starting to build. Then, of course, ovulation. It's not only important just for baby making. We do want to make sure that we are ovulating most months out of our lives, really, out of our reproductive years. When we're ovulating and we're having the most healthy cycles that we can, it truly is a predictor of good health. And I have that quote there that ovulation is important not only as an indicator, but also as a creator of good health. So we need ovulation to make life and to sustain our own too. And of course, ovulation is when we're the most fertile. Usually it's ovulation and challenges around that can cause some issues with our hormones and how regular they are. So if we're on hormonal birth control, if we're under eating, so not consuming enough calories, not consuming enough carbohydrates that our body needs, or just not enough nutrients, we'll see an anovulatory cycle or a cycle where we did not ovulate. And polycystic ovarian syndrome too, or PCOS, commonly known as, that is another condition that is an obstacle to regular ovulation each month. Then that luteal phase. So progesterone peaks after we ovulate, and that's because the corpus luteum, so the follicle that changes into that corpus luteum, it actually secretes progesterone. And progesterone, we have receptors for it on our brains. So it's nice and calming, and it has great effects for helping with sleep, calms the mind, helps with anxiety. And progesterone then falls to signal, along with estrogen, to signal the start of your next period. And we repeat the cycle over and over again every month. So what are your symptoms telling you? And I always like to remind anybody who's tuning in, listening to their body, or struggling with their own health, especially period troubles, just because a symptom is common does not mean it's normal, right? So I think we normalize a lot of the reproductive issues and symptoms, especially when it comes to period pain, heavy flow, moodiness, PMS. I think that's normalized a lot in our society, and I'm here to tell you that just because it's common does not mean it's normal. And usually these things are a sign of an underlying imbalance, and we can do a better job of supporting and optimizing your body to get rid of those symptoms. So, painful periods. What causes period pain? So prostaglandins, they are released by your uterine lining as it breaks down, and this stimulates your uterine muscle to contract and to shed that uterine lining. So when you're releasing the blood every month. Too many prostaglandins can contribute to pain. So yes, this is the normal process that happens, but when we have too many, we're getting painful periods. So what should we investigate in this sense if we're having these painful periods? Things we need to look at: inflammation and sources of inflammation in our life. So a lot of that comes from our diet, and this could be due to our common inflammatory foods such as dairy, gluten, processed sugar, red meat as well. We want to look at our endocrine disrupting chemicals. So I'll talk about this a little later as well, but things that disrupt and trick our body into thinking that they are hormones. So they act like hormones, they bind to our body's own hormone receptors, and they cause a lot of imbalance. And of course, we want to look at the hormones themselves. So what is happening with estrogen? What's happening with progesterone? And how can we optimize that? Next, we have heavy flow. So it affects 25% of women at least. And a heavy flow is defined as blood loss greater than 80 milliliters. And to give you an idea of a visual, that would be 16 fully soaked regular tampons over the span of your period. And a heavy flow would also be one that is lasting longer than 7 days and consistently heavy for those 7 days. It's very common that teenagers get heavy periods. So when their first few years after menarche, which is that first period, they're pretty painful or can be super heavy. And that's really because the estrogen sensitivity, your body's trying to figure itself out. And those receptors, which are not used to being activated in such ways, they're trying to get the lay of the land and get adjusted to things. And you're also likely not ovulating regularly as a teenager. So we're not producing enough progesterone to balance out that activity of estrogen too. So just a note on why teenagers get that, or you may have experienced that in your earlier years as a woman of the reproductive age, and you had heavier periods before that have balanced themselves out. This is why. So what to investigate if we're having heavy periods? So we want to look at estrogen. Iron is a really important one. So if you're low in iron, or if you're having a heavy period, you could actually be low in iron. So that's definitely a nutrient that we want to look into. So testing your ferritin in your serum. So taking a look at what your iron levels are at. Healthy gut bacteria we want to keep in mind so that we're appropriately metabolizing, digesting, and detoxifying our hormones. And thyroid health. So if your thyroid's not functioning optimally, we can see changes and we can have a heavy flow in that sense too. So irregular cycles. Now, what is a regular cycle? They range, so everybody's different, but typically they range from 21 to 35 days. Anything shorter or longer than that may indicate that you did not ovulate that month. Irregular cycles are common during the first few years after you get your first period, as I mentioned previously. Of course, also while you're breastfeeding, they're going to be irregular, and during perimenopause, so those transition years, which I'm going to talk about next week in particular, we're going to see a lot of variance and changes in the length of your cycle too. So what to investigate? We want to look at our estrogen, progesterone, and testosterone in this sense. So especially with women who may have polycystic ovaries or polycystic ovarian syndrome, we want to take a look and see what their testosterone and androgen levels are at, because they're usually high in this case, and that can prevent ovulation, which would then lead to an irregular cycle. Diet and nutrition are important too, so making sure we're adequately nourishing our body, giving it what it needs to carry through our monthly cycles. And we want to look at thyroid function as well. And then the next most common thing that I see in terms of what's going on with your cycle and what symptoms are telling you is PMS, which is a pretty broad term, premenstrual syndrome, but we can break it down into 4 subtypes. So we can look at PMS-A, which is the anxiety subtype. This is when you'll feel emotional, irritable. You might have brain fog, you're stressed easily, anxious, tight muscles, mood swings, spotting before your period. PMS-C is the craving subtype. So you might be feeling lightheaded before your period, hangry, that's a really standout one, dizzy, headaches, difficulty sleeping. The depressed subtype is when you might feel sadness, hopelessness, crying very easily, sleep issues. So you're either sleeping too much or not sleeping enough. Difficulty with focus and motivation. And H, the hyperhydration subtype. So this is when you're holding on to a lot of fluids. So water retention, bloating, breast pain, swelling, acne, and oily skin. So the giveaway that I've created for you guys is actually going to dive into these PMS subtypes and solutions that you can start to implement into your day-to-day lives to start taking a hold of that and helping manage those symptoms. So of course, I always love to talk about my best options that I can provide you with in terms of testing and assessing your hormonal status. So first on the list is blood or serum. And although this is a standard, like we're able to test blood as a naturopathic doctor, as a medical doctor, nurse practitioner, lots of different healthcare professionals can test hormones through the blood. It's nice and standardized, but we have to keep in mind that hormones are bound to proteins in the blood. So, and it is limited in terms of what we can test beyond the levels themselves. So we like to look at how our body is using, metabolizing, detoxifying those hormones in some cases. And that is a limitation that we're not able to look into that much detail when we're testing through the blood. But it is a great standard option and helps us to track, every couple months to see how we're doing with progress. Saliva. So this actually measures the level of hormones that have passed through the tissue. So we're getting an appreciation for the active level of hormones once they've carried out their intended effect. And we're providing insight into the levels of hormones that are able to target the tissue receptors. So they're no longer bound to proteins in the blood. They're actually carrying out their intended function. This is something that we use commonly to track women who are on hormonal replacements, so bioidentical hormones. We can use saliva to nicely track those levels. And urine. So urine is our most comprehensive picture of what's happening with your hormones. So we're able to look at our estrogens, our progesterone, androgens, our adrenal function as well. And in the urine, we measure something called metabolites. So these are byproducts that are available from our hormones at different levels of their detoxification and metabolism in the body. So it gives us a sense of what's happening with your liver as we're detoxifying those hormones, and very, very useful for especially estrogens, because we're able to see which types of estrogens are more predominant and can give us a lot of insight into what's going on with your hormones and your symptoms. So a naturopathic approach to hormonal balance. So especially if we have the common symptoms of painful periods, heavy periods that we know, just because they're common doesn't mean they're normal. We can look to the diet to see if there are certain sources of inflammation that can be contributing to these symptoms. So the foods that are inflammatory are processed carbs and sugar, cow's dairy, alcohol, refined meat, red meat, caffeine, and another way to see what foods are causing inflammation in your body would be a food sensitivity test. So that is something that I often run for my patients to see the immune activity that's being activated when we intake certain foods, and then the level of inflammation that's happening beyond that. So that is a neat way to get your body's blueprint on what foods are causing inflammation for you. Foods to include that are nice and anti-inflammatory: leafy greens, healthy fats, lean proteins. So especially, even fish, which have those great fatty acids, omega-3s that are so anti-inflammatory. And looking at more complex carbs. So not our refined carbs or processed carbs, but complex. So from root vegetables or whole grains would be a better option. I always love talking about seed cycling. So we can use seeds and the properties in them to achieve hormonal balance and to help the bigger picture of regulating our hormones. So during our follicular phase, that first half of our cycle, we can support optimal estrogen production, anti-inflammatory properties during that menses. That happens first. We can do this by eating flax seeds and pumpkin seeds. And if you're not a seed person, then you can take an omega-3 fish oil. And during the luteal phase of your cycle, so after ovulation until your first day of your next cycle, you can support estrogen progesterone balance, nicely support optimal progesterone too. Further help with that anti-inflammatory cascade by consuming ground sesame seeds and ground sunflower seeds, or you can take evening primrose oil for that. Another thing I love to encourage my patients to do is to download a cycle tracking app. So if you're not tracking your cycle, now's a great time to start. My favorite is Flow. I also have patients that use Eve Track or Clue. There's so many out there. It's easy to find one that works well for you and can help you gain insights into the length of your cycle. They'll predict when you're ovulating. Some apps actually have an integration where you can take your basal body temperature every day and plug that into the app. So that way we can see what's happening with the changes in the temperature and get a better prediction of when you might be ovulating. So very, very useful. It gives you that extra insight as to what's happening every month and how you can really take hold and, you use your cycle to be your best self in the month. And those endocrine disrupting chemicals. So as I mentioned, these are chemicals that bind to our hormone receptors, usually estrogen. So they're estrogen-like compounds that can cause havoc with our hormonal balance. So ways to eliminate endocrine disrupting chemicals and endocrine stress would be to ditch the plastics, so use glass instead, clean up your personal care and household products, find some better alternatives for your deodorant, your makeup, anything that has synthetic fragrance, consider switching that out for a cleaner alternative. Choose organic or farm fresh when possible. So a great way to identify which foods you should be purchasing as organic would be to follow the environmental working groups Dirty Dozen or Clean 15. The EWG also has a lot of great apps that I talk about all the time, but the Think Dirty app or the Skin Deep database, we can go in and it'll tell you any given product, its clean or dirty rating, the chemicals that are in it, and really, really great options for you to educate yourself there. So we'll dive into supplementation too as part of a holistic treatment plan for any hormonal imbalances. I'm always looking at what we can do with the diet, how we can address lifestyle, and supplementation as well. Sometimes supplementation involves the use of bioidentical hormones, which is something that I'm able to prescribe as a naturopathic doctor. So in some cases, we may feel that if there's such a deficient state or we feel like we could get better results supporting those hormones naturally through bioidentical hormonal means, then we will do that too. So just some basics that I wanted to give you guys, but for painful periods and cramps, my top contenders are magnesium bisglycinate that helps to relax those muscles, turmeric, curcumin, even ginger. These are lovely anti-inflammatory herbs, so we can help favor a better balance of those prostaglandins and relieve some of that inflammation that's happening. Fish oils are nice and anti-inflammatory as well. And then if we're looking at our specific hormones, usually we can get great results through Vitex estrogen detoxification too. So specific ways that we can better manage those symptoms. Heavy flow. So of course, I always look into your iron status. So supporting iron through supplementation, if we've identified that it is low, then iron bisglycinate is a form that's really well absorbed, gentle on the stomach. It does not cause constipation or any digestive distress. And also looking into the hormones, right? So making sure we're favoring an optimal estrogen detoxification, and we can use bioidentical progesterone in this case too, to help balance out and to decrease the amount of flow every month. I love to educate people on the nutrients depleted by the birth control pill. So of course, I have many young women in my practice who choose to use the birth control pill as their preferred form of contraception, which is completely fine. I'm here to help you and support you on as you are. So if this is the case and you're on the pill, I just want you to know what's being depleted so that we can help replete that and ensure that you are functioning as optimally as possible. So our B vitamins are big ones that we need to replenish. So vitamin B2, B6, B12, our folate, magnesium's another one, vitamin C, and zinc. So these are common nutrients that we need for adequate energy, metabolism, immune health, skin health, and our B vitamins actually themselves, we can support those in a lot of cases when we're getting painful periods or heavy flow. So these are all things that are good to replenish with if you are on the birth control pill. So thank you guys so much for sticking with me to the end of this presentation. I hope you all learned something. And I have a free download, a gift for you. So it is a PDF called Decoding Your PMS Symptoms. I'm going to post the link in this group so that you can download it right after I hop off this webinar. And it's going to talk about those four PMS subtypes, symptoms that you might be experiencing, what the culprit is usually. So usually the hormonal imbalance that is at the root cause of that, and some solutions that you can start to implement. And as part of the Women's Health series over the next 3 weeks, I'm going to be offering a giveaway. So at the end, I'm going to draw one lucky name. So you have to leave your name in the comments to let me know that you watched this, whether it's live or on the replay. And I'm going to raffle off a free initial visit for any new patients who haven't seen me before, or it would be a follow-up equivalent if you're already a patient of mine, and a 10% discount on a hormone test of your choice. So this is something, my gift to you, to celebrate your choice in choosing better health, getting those answers, being an advocate for yourself, and we're choosing me as your naturopathic doctor to help guide you through that. So this is something that I will announce at the end of my 4 weeks, so at the end of the month. So stay tuned for that. You guys can enter as many times as you wish. All right, so that wraps up tonight's series, tonight's webinar. Coming up next, so next Wednesday at 7 p.m., I'll be talking about menopause. So managing menopause, common symptoms, and how we can start to address that. Following week, I'll be talking about the ovary, adrenal, thyroid axis. So this is truly foundational to any hormonal imbalance, especially if we're experiencing thyroid issues or chronic stress. This is something that we need to look at. And to wrap it all up, at the end of the month, I'll be going live to talk about skin health, so radiate from within. Another one of my favorite focuses in practice that I love to help people with is getting that glow from the inside out. So stay tuned for this coming up over the next month. Thank you so much for tuning in, and we will talk soon. Take care, guys.